a special plan for Congress. Will I go to jail if I don't have health insurance? No. Underneath the House bill, though, if you don't want to participate in the health insurance, you still have to contribute 2.5% payroll. And I know young people always say, I don't want insurance, I don't need it. But the insurance infrastructure has to be there. And if we're going to have a national health care system, we all got to pay into it. It's not fair to say, I only want health care and I only want to pay for it when I need it. We got to pay for the hospital, we got to pay for the ambulance, we got to pay for those health care professionals. It's 2.5%, just like Medicare. We're not on Medicare, but we're all paying for part of it, aren't we? So the system's there. The jail part, if you try to cheat the IRS, jail's one of the options. You're not going to jail if you don't have health insurance. Pay your 2.5%, move on. Can we afford it? The health care reform bill must be paid for, not add to deficit. The President indicated that September 9th. Where does the money come from? In the House bill. I'm talking about the House bill now. If you make more than $500,000, you're an individual, you make more than $500,000, you're getting a surcharge. 99.9% of us in the 1st Congressional District don't make that. If you're married, you get $1 million credit before you have to pay the surcharge. There are actually 270 households in the 1st District that would have to get the surcharge. If you're not one of those 270, on this part, you don't have to worry about it. More than half the cost is paid for by squeezing inefficiencies. And I'll explain that later. That's the quality or with long-term savings, okay? All right. What will happen to Medicare? Nothing. Everyone says we're cutting the heck out of Medicare. We're not changing Medicare. In fact, in the House bill, what we're doing with Medicare stays the same. Choice doctor and hospitals. We don't use any money from the trust. We eliminate the copay for deductibles, preventive care. We don't do that right now. You go get screened for prostate, you pay for it. If you're 7 years old, you pay for it. You're screened for diabetes, you pay for it. We feel if we pay for it early, catch that prostate cancer early, which has a 95% cure rate, if we catch it early, we save money, we'll pay for that preventive service. We actually extend Medicare by solvency by at least 5 years through some of the provisions we make in the House bill. Part D, what will happen to Part D? That's prescription drugs. We fill in the donut hole. Next year we add 2,500, it'll be 3,000 before you go in the donut hole. Next year it's more. By 2016 it's filled in. You don't have a donut hole anymore. We give Medicare, the Secretary of Health and Human Services. We passed this big prescription drug plan, but we said, oh, by the way, you can't negotiate. You can't use the purchasing power of the federal government to lower the cost of drugs for the American people. That was insane. We changed that. We allow mid-year changes in your enrollment, which you can't do right now. All right.